Yeah, of course. So we know that information and technology continues to be integrated into medicine, and so especially with AI being really forefront of the past couple of years and anticipated continuing, we just wanted to evaluate what the current atmosphere looks like with AI and OBGYN care. So specifically, we had the question about how does AI counsel patients regarding Tylenol, and so there's been a lot of misinformation and disseminated across social media and the news, and so we wanted to see kind of what our patients who are engaging with AI are getting. So we asked a couple of different queries, pretending to be like a anonymous pregnant individual on like a third-party ChatGPT account about questions regarding safety of Tylenol, whether or not there were associations with autism, dosage, any concerns, and then as well as kind of trying to parse out if there were any specific like citations or sources that they could give. And so it ended up being a little bit more affirming than kind of anticipated. And so the ChatGPT did give us some pretty clear answers that were pretty digestible as well for patient care, which was good. And it did discuss a little bit some of the differences in like opinions as well as different kind of studies, but it did kind of give baseline facts that it continued to point the patient to, which was good. And then it also directed the patient toward evidence-based societies such as like the Society for Maternal Fetal Medicine, as well as ACOG, which of course we're here for that today. And so that was great too, that it was able to point our patients to kind of other resources, and then also allow the patient to be aware of where this information is coming from and what they can do to find more information. I think it's really important. It can definitely be a really good tool. With tools, it depends on how you use them. So we can use this tool to help the burden of difficult access to care, of misinformation potentially, of like patient education and patient advocacy themselves. But it can also be a double-edged sword if it goes untouched by providers and untouched by the evidence. And so that's one thing that we as clinicians and as physicians, providers want to be aware of is kind of what are our patients engaging in, and how can we ensure that they're engaging appropriately in ways that are best for their care, and not just what is the easiest, fastest, maybe most clickbait-worthy answer. There's definitely risks in that, and so that's why it's so important that providers and clinicians be involved in the development of AI and kind of the incorporation of AI with medicine, so that we can make sure that everything is as science-based as possible. However, understanding that that might not always be the case, I think that it's really important that we continue to just discuss this with our patients. Ask them where they're getting their resources, ask them kind of their thoughts. The majority of our patients have already self-diagnosed and done their research by the time that they get to us, which on one hand is good for their own learning and our shared learning, but also it's important that we be aware of that so that we can kind of help tailor and direct them for, again, their betterment of health.